Hello everybody, and thank you for joining me for another Ask Dr. Bob. And we have several questions tonight. I'm going to get right down to it. Does eating fruit, add to a yeast challenge in a person's body? Yes, it does. Actually, there's only three fruits that I recommend. Apples, pears, and plums. All other fruits tend to create what we call adrenal fatigue. I'd encourage you to get a book called The Yeast Connection by Dr. Crooks. That book will help give you specific fruits which you should stay away from, which is basically all of them. You do not want to be doing bananas, raisins, grapes, and for sure no pineapple. I had someone contact me and they said, you know, Dr. Bob, I'm having pain in my groin and pain in the front of my leg. When somebody has groin pain, that usually means that there is a vertebra out in the lower part of your spine. I don't even like to use that word out. You have a pelvis distortion where your sacroiliac joint is not functioning optimally. And when the sacroiliac joint twists, a part of the pelvis turning, it affects your groin. She started taking some calcium, which we recommended, and also I know vitamin D helps chronic low back pain. I would encourage you to have a vitamin D test. You can go to our website, contact us. We can send you a kit anywhere in the world. But I know when you have pain in the front of your thigh, it's coming from the upper part of your lower back. And I'd like you to get on all fours and do what we call the cat stretch, where you're literally arching your back up and you're like a cat does, strengthening your core. That'll unjam those joints where the nerves are coming from that go to the front of your leg. I have someone that contacted me that has a 6-year-old granddaughter, and my heart goes out to you wherever you're at in the world right now. I know that you purchased our ADHD book. You're at your wit's end because your daughter, who is the mother of this grandchild, is not very supportive. I know that you've given this child the products, the ones that we talk about in Dr. Bob's Guide to Stop ADHD in 18 days. But you don't give the child the supplements consistently, and I know the child, when it goes to the mother's house, is eating a lot of food that's inappropriate. I share your pain because this is a process. I believe the biggest challenge I see with ADHD and using Dr. Bob's Guide to Stop ADHD guidelines, it's counterculture, because everywhere you go, they're asking you, are you hungry? Do you want to eat this? Soda pop. So my suggestion would be to really sit down with the mother and have conversation with the mother about the significance and the importance of eating properly, because if this child ends up on medication, those medications could lead to stronger medications down the road. It's about physiology. You want normal fat metabolism. There was somebody that was watching me on TV, and we've been so blessed to be on TV all over the world, and I do appreciate the email, and I appreciate it when people watch us on iHealthTube and on Drugless Doctor YouTube channel. But they wanted to know that they have a hard time falling asleep and staying asleep. I know individuals who have high copper. They usually have a hard time falling asleep. What happens is when you eat wheat and soy deplete the body of zinc, which means your copper goes up. Ann Louise Gittleman, a friend of mine, she wrote the foreword to my ADHD book. She wrote a book called Why Am I Always Tired? This is very common in individuals who are vegetarians. They have high copper, they have low zinc. If you go to our website, which is druglessdoctor.com, you can order the aqueous zinc test. You want to take zinc before you go to bed, because zinc's going to help lower the copper, or you can take zinc up to a capful during the day. Calcium lactate or citrate before you go to bed will help calm you down. If you wake up about 2 hours later, it usually means you need B vitamins. If you wake up at 1 or 2 o'clock in the morning, it's a body signal to me that you may in fact have parasites. And I pray this makes a difference for you. I had someone contact us that has constant urinary tract infections. They've been a fan of ours. They're part of the Dr. Bob culture. They've read Dr. Bob's Guide to Optimal Health, and they use lemon every day with water. And I think that's awesome. Yes, the lemon and water could be alkalizing your body, to the point where you could have a chronic urinary tract infection. So I would suggest for 1 month, stop the lemon water. If you're over 40 years old, I would get some organic apple cider vinegar. We use a product from Omega Nutrition. I know I've seen women that have had chronic shoulder pain right here. It's called deltoid bursitis, common in women over 40 years old, as well as fibromyalgia. So urinary tract infections, stop the lemon water for a month. If that helps, awesome. You may want to incorporate some apple cider vinegar, 1 ounce per day. Do not drink water with your meals. Dr. Bob, I started taking some product that you recommended a week or so ago for detoxification, and you're also using the castor oil pack, and you're starting to see symptoms. This is not uncommon. When I was a kid, way back a long time ago, we used to have gasoline engines, and some of you watching me right now, maybe you remember, because you might not even be watching me on the internet because you can't figure out how to get to it, but we used to have to get a rope and wrap the rope around the mower and pull that engine really hard to get the mower to start. It was so archaic. But when we get an engine to start for the very first time, after a season, black smoke would come out. That black smoke is residues from the long winter time. If you're on any type of detoxification, whether it be something that we're recommending through our detoxification book or something you read on the internet, and you start going through a detoxification process and you don't feel good, hang in there. You're loaded with toxins. It's all the more reason for you not to deviate. What causes twitching in the eyes? You know, sometimes your eyes start twitching. Calcium citrate, calcium lactate. Calcium citrate, 4 or 5 on an empty stomach. Probably best to take them before you go to bed at night. You may want to incorporate some L-lysine. L-lysine is good to prevent cold sores. L-lysine helps the absorption of calcium. What do you do for ringing in the ears? Very common problem. One of the challenges that we usually see is a low thyroid gland. I would encourage you to have a TSH, a T3, and a T4. TSH, Tom, Sam, Harry, T3, T4. We talk about this in great detail in Dr. Bob's Guide to Balancing Female Hormones and Dr. Bob's Men's Health, the Basics. We have just commonly seen low thyroid gland and subpar adrenal function or adrenal fatigue are most common body signals and reason that you could literally have ringing in the ears. What iodine supplement is the best? Well, in our practice, we use a product called Iodine. Iodine has iodine and iodide. I take 12 milligrams of Iodine every day. I do not want any of you watching me right now to go out and buy iodine and start taking it unless you have some type of testing done. You should check your T4, Tom 4. It should be at a level of 8. You may want to do the urine iodine loading test, and the reason is this. If you have a shower at home, which of course you do, and you're taking a shower without a dechlorinator, chlorine is toxic to the thyroid gland. So is bromine, and so is fluorine. So start your iodine slow because you might notice a metal taste in your mouth, a rash, headache, and nausea. Here's a very interesting question. Dr. Bob, I have age spots, and they're growing. Liver spots, they also call them. I want you to know that it probably is a liver challenge. Your liver is being compromised. We use milk thistle. I personally take 5 drops of dandelion root every day. We have a product that we use called Livertrit. You could eat the ever famous Dr. Bob's ABCs, a half a red apple every day, 1/3 cup of beets, 1 medium carrot at least on a regular consistent basis. Your skin is your report card. If those liver spots or age spots are growing, liver compromise. Somebody asked a question about TSH, Tom, Sam, Harry. They live in Canada. Their results were exactly 1.58. And the range goes from 0.35 to 5.5. And they watched me in another video and they said, Dr. Bob, you mentioned you wanted your TSH to be above 2. That's exactly right. If your TSH is less than 2, that means you probably have a stressed pituitary gland. You are in stress. You need minerals because stress makes an acid environment. We use a product called PT, that's Paul Thomas / HPT, Harry Paul Thomas, up to 6 a day. 1.58 is not bad, but we want it greater than 2. And the same person also talked about facial pain. Facial pain is very common with lack of calcium. I had one last question somebody talked about, and by the way, calcium, 4 or 5 calcium citrate or lactate before you go to bed at night. Final question, somebody has irritable bowel syndrome. Here's number 1, eliminate all dairy products for 1 month and watch how much wheat, barley, rye, and oats. You may have a gluten challenge. I have a little secret for you. You could do something called an adrenal stress index. It's a saliva test. We can check to see how your gliadin level is. Gliadin tends to elevate in individuals who have a gluten sensitivity. Great questions. We thoroughly enjoy answering them. Thank you for joining Ask Dr. Bob. Pass it on. Thank you.